it's Dr. Pryor, and I wanted to come make a video today because it is May, and May is the ALS Awareness Month. So basically, ALS is a neurodegenerative disease. I actually lost my father to this disease, so I have researched it a lot, and I do have the pleasure of treating patients that have this disease, and I consider myself a specialist in this disease. So basically, it affects about 5 out of 100,000 people. It's diagnosed usually around the age of 55, but as you get older, the risk of being diagnosed goes higher. It is more common in males, and I think it's more common in males because males play sports and can get head injuries, which start an inflammatory cascade in their central nervous system. They also work in jobs where they're exposed to chemicals and pesticides more frequently, and we know those are neurotoxic, so that's why I think males get it more frequently. It does have a familial component in about 15% of people, and basically they have a genetic cause of the disease, and that leaves about 85%, which are sporadic. But even in sporadic, there's often a genetic cause. It's a de novo mutation, meaning a new mutation that just happened in them. And that is why, if you're diagnosed, we'll often want to do genetic testing just to see if there's a genetic cause so we can target treatment. Basically, if you have the disease, there's two main ways it starts. There's limb onset, which is in about 70% of people. It is by far the most common, and it's what my dad had, and it's also what my patients I've treated had. And basically, all of them had onset in their lower limbs. And so one symptom that I've heard universally is tripping. And they don't know why they tripped. So for my father, he fell off a ladder. Basically, his left foot slipped off the ladder and he didn't know why. But that was his first real symptom. About a year before that, though, he had cramping in his lower calf muscles, and with my patients as well, they had tightness and cramping in their lower limbs. But basically, weakness in the feet, in the ankles, the hands, the shoulders, the hips, weakness in any of these that's unexplained, that is the first signs of ALS, and you should get evaluated. And about 25% of people, they have bulbar onset, which basically starts in the brain stem, and the cranial nerves come out of that, and so it affects these nerves. And basically in bulbar onset people, they'll have problems with drooling, they'll have a hard time with their speech, they'll have slurred speech, they can have swallowing difficulties with their food and such. So basically, if you have any of these symptoms, please get evaluated, because as a specialist, I understand that the sooner you get diagnosed, the sooner we can start treatment, the better. So basically, if you or any of your family or friends have these symptoms, please talk to them and tell them you know that this could be ALS and they should really be evaluated. Because like if you were listening before, my father had cramping for a whole year. He even fell off that ladder and broke his ankle, and even then he still didn't go get evaluated because he didn't know that I didn't know. I was not educated in this, so we need to know these things. So, anyways, like I said, I just wanted to make this because May is the month of ALS awareness. Thank you for listening. If I'm not your doctor, get advice from your doctor. If you could please subscribe, please. And I am accepting patients. You can always reach out to me on my Instagram. But have a good day. Bye.